Well, good afternoon. Over the past few weeks, we've seen what the people of Ontario are all about. People and businesses stepping up, rising up to the challenge, embracing the Ontario spirit, and doing their part. Whether it's the millions of people who are listening to the direction from our health officials, doing the right thing and staying at home, or the real heroes out there, the nurses caring for our seniors, the companies retooling to produce essential medical supplies, or a grocery store clerk helping people keep food on the table. These are the frontline heroes. And make no mistake, this is a defining moment for our province. It is in these difficult times that our best of us shines through. These folks are all playing on Team Ontario. But unfortunately, there are also a few bad apples out there. We've all seen the terrible examples of those who are trying to take advantage of vulnerable people during these dark days. Those who see one of the darkest periods in our province's history as an opportunity to gouge people and make huge profits. My friends, I have zero tolerance for this kind of nonsense. And I need to take a moment to recognize the incredible leadership and the dedication that our major and independent retailers are showing right now. We work closely with the Retail Council of Canada and the Canadian Federation of Independent Grocers on the new measures I'm announcing today. They get it, and they support us 100%. And we all recognize the incredible people out there working hard to keep food on our tables. But, like us, they want to go after the bad apples. So if you're out there trying to price gouge and take advantage of this situation, trying to take advantage of the most vulnerable people right now, buying cases of essential goods, hiking the price and selling it back to people who really need it, then stop right now, because it's un-Canadian, it's wrong, and today we're putting an end to it. Last night, my cabinet approved an emergency order that will throw the book at these type of people. If you're selling face masks, protective gloves, cold medicine, hand sanitizer, and disinfecting wipes, and you're hiking the price 5 times, 10 times what it should be, you're done, you're gone. Because we're coming after you. We have drastically increased the penalties you will face for this disgusting activity. We're coming after you, and we will shut you down. The new enhanced penalties include summons to court. And if you're convicted, you could face a maximum fine of $100,000 and a year in jail. And if you're a corporation and you're convicted, your company director could face a penalty fine up to $500,000 and a year in jail. And the corporation could face a fine of up to $10 million. We're taking this very seriously, and I'm asking the public to help. Help us find these people. If you see somebody that is clearly price gouging on essential goods I just mentioned, let us know. Contact Consumer Protection Ontario online or at the 1-800 number. It's 1-800-889-9768. I'll repeat that. That's 1-800-889-9768. That line will be open Monday morning. We're going to help everyone, including our seniors and those with disabilities, have access to these necessary goods. My friends, we're prepared to do whatever it takes to keep our people and our community safe right now. And later today, my cabinet will be discussing additional measures to protect Ontarians during these difficult days. We'll discuss new emergency orders based on the latest advice from our Chief Medical Officer of Health. We'll look at further limiting non-essential gatherings, down from 50 people to 5 people. If approved, this will come into effect tonight. Essential businesses, childcare facilities, and families with more than 5 people will be exempt. And I'll have more to say about this later today, because we all need to do our part to stay ahead of this terrible, terrible virus and flatten the curve. And I can't stress this enough. When you get home from the airport or crossing the border from the States or flying in from abroad, please stay home. Don't go get groceries. Don't go out to see your friends. Stay home for 14 days and self-isolate. Don't put the people around you at risk. You're placing your family, your kids, and your grandparents in jeopardy. If you want to support our frontline healthcare workers, if you want to protect our healthcare system, if you want to beat this virus for good, please do your part. Stay home, wash your hands, and practice physical distancing. We're at a critical moment, and if we do this right and listen to our medical experts, we'll get through this. Thank you, and God bless the people of Ontario. I'll take questions now.
Okay, we'll go to the phone line. First question.
Your first question comes from Kari Verma from CBC National News. Please go ahead.
All right, thank you. Good morning, Premier. Good morning, Minister Elliott. You guys sent out a press release this morning about measures to improve procurement. Where does procurement of PPE and ventilators stand today? Have you guys received any of the ordered N95 masks or any additional ventilators, and have they been disseminated to hospitals?
Well, we'll tell you where we are on the procurement side. We have ongoing orders, meaning rolling orders. So as soon as they get enough, they'll ship it out. So we have, as I mentioned, 5 million N95 respirators that are coming in. They're rolling in as we talk. Not all 5 million at once. We mentioned, the procurement department mentioned to the companies that will take whatever they have, so they're rolling in as we speak. The ventilators, as much as we're ordering off other companies in the U.S., and we might be getting 5 or 10 at a time, we're working, as I mentioned, the 4 major auto manufacturing companies putting together a line and putting their engineering might and manufacturing might behind this. We ordered 10,000 ventilators, and over the next 4 weeks approximately, they're going to be up and running, and the assembly line will start. So we're focused on that. Not only are we focusing on that, we have a whole team, sourcing team out there, and they're going out there and talking to people. I want to share a little story with you. You know, I get a call from someone and said, hey, I understand there's a small company, and there's so many of them. I've talked about the distillers, but there's a small company that's retooling, and they're up in your area, up in Rexdale. So I look them up, and I find their address, and I decide to hop in the car early this morning to drive by and see this company to see if anyone was there. And so, sure enough, there was a car there. I go in through the side door, and there's 3 gentlemen there in the back. And I don't know who was more shocked, them seeing me walk through the back door or me seeing them produce hand sanitizer. And I always give a call out to these great companies. This is a small company. The 2 sons were there with their father on this machine putting together hand sanitizer. What an incredible story. Getting chills telling you about it, because you see a family working around the clock, putting together hand sanitizer. And I asked him, you know, I see the prices in the stores, and I said, well, what is a container this size? And it's a fair size container. He said $15. And he was doing the smaller ones too, $5. And then he had the big, large jugs, and he said $40. That's what I call the Ontario spirit. That's a company, and I'm going to call them out, contract packaging. They didn't know me from a hole in the ground. I didn't know them. I heard about them, and I showed up, and I want to thank them. I want to thank the small family-run business, having the sons there working all weekend around the clock. They're telling me they're putting in endless hours. These are the companies. These are the companies that pitch in, help out, and that's just another incredible story. I could tell you story after story after story. So that's a great news story, and we're going to go and to our warehouse, and we have the best provincial staff ever anywhere. They're working around the clock, and I asked the procurement manager. I've been procuring for 30 years before I was in this line of business and politics, and I just want to go by, trust but verify. And not that they're making any mistakes. I want to physically go in the warehouse and do a quick count. I want to see it myself, and I have all the confidence in the world, but I know big corporations, and Ontario's a big corporation, but we're going to go there and I'm going to do a quick little, small little audit on essential items, be it the gloves, the N95 masks, face shields, gowns, and nothing's better than seeing it yourself. So again, I want to thank the staff that's been working around the clock, all the sourcing team, the procurement team. Everyone's busting their back to make sure we get these critical items into storage here.
And my follow-up question is for the Minister of Health. Southlake Hospital in Newmarket says they have 6 of 15 ICU beds with COVID-19 patients. Their CEO told Mike Crawley last night he expects their ICU to be full with COVID-19 patients in a matter of days. So what measures is the government taking to support Southlake? Are you considering deploying additional ventilators? Are you considering deploying even the emergency management tent hospital? Any specifics would be appreciated.
Well, we will deploy whatever resources Southlake needs. We know that there are currently 46 people in Ontario who are on ventilators right now. There's 63 people that are in intensive care. We will supply Southlake and any other hospital that needs additional supplies, and we also have the ability to move some of their activities if they have a capacity number of people with COVID-19, then there are other hospitals in the area that are prepared to take up the other work that Southlake or any other hospital is doing. So we are prepared to move very quickly. We have the supplies, and we want to support our hospitals with whatever they need.
Next question.
The next question comes from Tracy Tong from CTV News Toronto. Please go ahead.
Hi, good afternoon.
Hi.
This question is for the Premier. I want to know, back to your announcement today, if you could paint a picture of how widespread price gouging is right now, how many cases have come to your attention, and what will enforcement look like? Are we going to see, police services getting involved in raiding and arresting in stores?
Well, no one knows prices. People know a lot of things, but there's one thing they really know when they're out shopping, and the person that does the shopping in the house, they know the price of every good they're buying, and they know if they're getting gouged. And we've been working with the Confederation retailers, grocery retailers, and they're doing the right thing. The large companies are doing the right thing. What we're concerned about is these folks that are going into retailers, loading up, and I've heard so many stories, a grocery cart of, let's say, hand sanitizer. And all of a sudden, they're going online, be it Kijiji, or they might be bringing in a small corner store and jacking up a price. It's unacceptable. There's, again, one thing people understand. They understand a lot of things, but one thing is when they're being gouged with groceries or essential items, because that's what this order is for the essential items. And we're going to make sure that we have that 1-800 line. If you see this happening, send it in. We will have bylaw officers go in there, and we're going case by case, and they're going to be prosecuted. If we see massive price gouging, the fines are going to be staggering, $500,000, upwards for corporations up to $10 million, and a possible year in jail. It's unacceptable. There's so many great companies, like the one I just mentioned, Contract Packaging, $15 for this. They're working their back off. They aren't making tons of money. They're working hard, family-run company, and there's so many companies that are rolling in. So there's very few bad apples and companies, but they're out there. And I think it's disgusting. How can you take advantage of people in this critical times that we've never seen in our province or around the world? and there's actually opportunists out there trying to gouge the people, I'm coming after them with vengeance. It's unacceptable.
And a second question, a follow-up question. Some provinces are asking landlords to be lenient on collecting rent. As you've mentioned, you understand landlords have mortgages and fees to pay too. We know that government money from the Emergency Response Fund won't start flowing until mid-April. So what is Ontario doing with April 1st just around the corner?
Well, I've said over and over again, and I just got to emphasize this, please do not take advantage of this situation. You see online, just don't pay your rent. No, Doug Ford is not saying just don't pay your rent. If you have the money, if you have a job, pay your rent. Some of these landlords are just, they're common folks. You know, they might have an apartment unit or 2 apartment units, and they're relying on that to live just like the rest of us. And then there's the big corporations that own, you know, thousands of apartments. I want to reinforce this. If you can't put food on your table and you're in a crisis, put food on the table before paying your rent. That's what I'm saying. But discuss this with your landlord. You know, it's just the right thing to do. Talk to him or her and say, hi, I'm in a crisis. I just can't survive. Maybe we'll try to make it up later on. But I just want to be fair to everyone. You won't be thrown out of your rental unit. But please work with your landlord.
Next question.
The next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Good afternoon, Premier. These measures around price gouging, I have to ask, will you also be looking at wholesalers or manufacturers? Some retailers are claiming they're only charging higher prices because they're being charged higher prices from suppliers. Will it just be retailers that you look at, or will it be both sides of the
well, we'll look at all sides, and Brian, we're going to do this case by case. So if we see a case, we will look into it. The inspectors will go in, and we'll make sure we listen to the story, because I understand what you're saying. But in saying that, like, I'm going to just throw in an example. You know, say a small bottle of hand sanitizer is typically, and I'm just throwing out rough numbers, are $5 in the big retailers because they have buying power. Everyone gets that. They also get, when they're going into their convenience store, that $5 jug of hand sanitizer might be $7, $7.50, where it's unacceptable. And people know this. People know this better than any of us. And you're going in and you're finding that little jug that's typically $5 being sold for $30, or hand wipes that are typically $5, $6, $7 being sold for $30. That's gouging. And people know that in a heartbeat. So the best policing is going to come from the 14.5 million people in Ontario. So they understand that. And they also understand if they're paying, a manufacturer has to pay their employees double time, then they understand that. It might go up a little bit. We're talking when they put a 500% markup on it, or 1,000% markup on it. And again, there's no one better to police this than the people of Ontario.
Wondering if you have a reaction to a story in the Toronto Sun about a young woman in Hamilton who forged a doctor's note claiming that she had tested positive for COVID. She's now been charged with fraud. The restaurant in question was forced to shut down, send all their employees home into isolation, spent quite a good sum of money cleaning the restaurant because they thought that someone with COVID had been in there working, and all of it was false. Do you have a reaction to that sort of thing?
Brian, anyone who hears this story, it's disgusting. What human being would do stuff like this? We're in a crisis, and they're going out there and lying and putting people in jeopardy. Like, it's disgusting. I'm glad the person should be charged. You know, we're in a serious crisis here. No playing games. No saying you have COVID when you don't, when real people are getting COVID and our hospitals are out there trying to help people. And we have some person going out there and falsely saying that they have COVID.
Next question.
That's disgusting.
Next question comes from Erica Natividad from City News. Please go ahead.
Hi, good afternoon, Premier. I'm just wondering, the federal government announced today that those who are symptomatic will be denied boarding on domestic flights and intercity passenger trains. Wondering if that includes Metrolinx, and if so, how that would be enforced.
Yeah, that's a good point. I will talk to Metrolinx. I'll be very upfront. I don't have that answer right now, but I promise you I will get back to you. I'll get on the call as soon as we finish this press conference, and we'll get that answer for you. But again, folks, if you aren't feeling well, you have symptoms, and vast majority, 99% of the population, everyone's cooperating. You know if you have symptoms and you don't have symptoms. If you have symptoms, you know, stay isolated. Very simple. Go get the assessment test to make sure you're okay. But again, people have to use their judgment, and vast majority of people out there, it's incredible. You know, I say for all our ministers in the government of Ontario, we have the best army anywhere in the world. It's called 14.5 million people that live here in Ontario that are out there doing the right things, helping out, stories after stories. It's amazing. There's more good, 1,000 times more good, than there's a small group of, I call them bad actors, rotten apples out there doing things that we're hearing about right now. But if we put pressure on these people and the government's going to come down on them, I don't think they'll be doing it for too long.
I also have a question about the measure to limit gatherings from 50 to 5 people. I wonder how that's going to be monitored and enforced as well. Well,
again, we have to trust the people out there. And, you know, if you have a family of 6 or 7 or 8, you get it, right? You don't go out for the most part. You stay at home, and everyone's cooperating. You know, talking to people across the province in small towns or large urban settings like Toronto, I look out the window at Queen's Park, and I never see more than maybe 2 or 3 people, maybe jogging or walking. You know, people get it. For people that loved ones pass away, there's an exception. You know, the funeral homes, I understand, talking to some, would let people in maybe 10 at a time, get them spread out, and then the next 10 will come in. Because if you're grieving for a loved one, you know, that's understandable. But to have a party or have a social gathering, that's unacceptable. And since even when we had 50 people, I haven't seen large gatherings of social events. I just want to thank the people of Ontario for listening to our Chief Medical Officer, our healthcare experts. I'm so proud of the people of Ontario.
Next question.
The next question comes from Rod Ferguson from the Toronto Star. Please go ahead.
Hello, Premier. I'm just checking in on something that Stephen Lecce was saying when he was out last weekend about daycare. There were a lot of parents concerned that at licensed daycares, they were actually still on the hook for paying, even though the daycares are closed. So apparently something was in the works on this to stop that or mitigate that. Yeah. Where are we now?
So good question, Rob, because I got the same phone calls from people, and one person gave me an example of, you know, they were worried if they didn't pay their $400 that they pay, I think it's every week or every 2 weeks, that they'd be yanked off the list and then lose their spot. That's unacceptable. I know Minister Lecce should be coming out with a statement, I believe on Monday, but we'll make sure we clear it up. I'm getting the exact same calls, and they shouldn't be charged. That's not fair if they aren't taking care of your children, and they shouldn't lose their spot either if they don't pay. So these are just some areas that, again, you know, if you're a daycare owner, don't take advantage of people, because we'll catch up to you, and we'll get you if you start gouging the people. That's what it comes down to. But Rob, I know Minister Lecce will be coming out with something in the next few days on it. He's well aware of it. Actually, I called him close to midnight the other night and told him the same story that I heard. So we'll get to the bottom of it.
All right, and just another quick one for Minister Elliott. Minister, I was hearing what you were saying about masks and supplies this morning. Today I was watching on CBC, a woman from Sunnybrook was there saying their COVID-19 unit is at capacity, and the big concern is masks. They get 2 masks for a 12-hour shift. They're all done up in protective gear. It gets pretty hot. The masks get really sweaty. Why can't you get them more masks?
Well, we are
hearing this from other hospitals too.
Well, we are supplying them with more masks, and what we're developing is a central supply area that hospitals can let us know on a daily basis what's happening with their supplies, and we'll get them to them. We want to make sure that our frontline healthcare workers are protected, and if they need more gowns or face masks or whatever they need, we want to make sure that they get them in good order, because it's the frontline staff. We need them to continue to be safe and healthy. We want them to be safe with their own families and, of course, with their patients. So we are continuing with our supply. As the Premier said, we have supplies coming in on a rolling basis from our regular suppliers, but we're also discovering new suppliers within Ontario. So our procurement process is going well, and we will continue to make sure that the front lines are well supplied.
Next question.
The next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thanks very much. I just want to follow up on that last question for Ron, Health Minister, because there have just been, we've heard you the last few days talk about the fact that the procurement process is coming in and more supplies, but as you just heard, every day there seems to be another story about a lack of supplies. So I guess my question is it fair to say that the province did not have the right amount of supplies at the beginning? I understand you're getting more now, but at the beginning of all this, is it fair to say the province did not have enough supplies to start?
No, we had enough supplies to start, and we will continue to have enough supplies. I know that hospitals are concerned, other healthcare providers are concerned, that we want them to be reassured that we are receiving those supplies in, that both the Premier and myself are on the phones on a daily basis procuring additional supplies. We've had offers coming in through Ontario Together that we are developing an Ontario homegrown solution, because we want to make sure that we don't have to be completely dependent on supplies coming in from out-of-country sources. We'll continue to rely on those supplies, of course, but we also want Ontario solutions. So Ontario hospitals should be reassured that we will continue to have supplies coming in for them and for their frontline healthcare workers.
And for the Premier now on unemployment. Premier,
Lucas, I apologize. Let me jump in there, because we get this question every day. We're going to get on a phone conference with every CEO of every hospital in this city, in this province, and we'll give them clear direction. If frontline healthcare workers need more than 2 masks, and it's not us, because I truly do not believe in be a Premier or Deputy Premier or anyone directing hospitals. We will voice our concern, like you're voicing our concern, because it's critical. The frontline healthcare people are making sure they're taken care of. Once we do the spot audit and we know and confirm exactly what we have, we'll make sure the frontline people are equipped. I had an opportunity with Michelle D'Emmanuel, the CEO of Trillium, yesterday. I got on the phone. I talked to 1,000 frontline healthcare workers on a conference. I thanked them. I want to thank them from the bottom of my heart for the job they're doing, and I promise them, as I promise everyone, we'll make sure you have the supplies that you need. And we're all over this, and I promise you, we'll get this conference, because I hear it every press conference, and naturally, it's concerning. But I want to make sure the numbers are adding up to what each hospital is getting, and the frontline people get the tools that they need. I apologize. The other question was?
Oh, thank you, Premier. Yes, just a little bit down the road. You've said before all this happened that you constantly talk about job creation, the booming Ontario. And I understand that measures are being taken now to try and stem the tide down the road. But chances are that by all indications, you're going to have a pretty big unemployment problem on your hands in a few months, specifically hopefully when this is all done in a few months and people are going to try to go back to work. How are you going to deal with that? I know you were very much in favor of the small business wage subsidy increase, but how are you going to lead the effort when people try to go back, potentially a ton of people trying to go back at the same time? How are you going to manage that?
Well, our economic development team, along with our Minister of Finance and President of Treasury, we've put together a strong plan to drive the economy. We aren't waiting until we get through this. We know we're going to get through this, and we're going to get through it together and come out strong at the other end. But we have to make sure that the companies are strong, especially small businesses, that they get the proper support from all levels of government. I want to, again, thank the federal government for their subsidy yesterday. It made a huge difference, going from 10% up to 75%. We appreciate that. We have a great team, and we're going to take the same approach as when we took office 19 months ago, when we saw jobs leaving this province, over 300,000 manufacturing jobs leaving. And in 19 months, we were able to ramp up and create 307,000 new jobs. We're going to take the same strategy, making sure that we have incentives, cutting WSIB premiums, making sure we reduce taxes, taking the burden off these companies, making sure that they're able to get back on their feet and start driving forward. We have to make sure that the consumers feel confident and they have certainty, along with companies out there, keeping the hydro rates as low as we possibly can to make sure they're competitive to sell not just across Canada, but across the world, and to our partners down in the U.S. that we're doing before $390 billion a year in two-way trade with our U.S. friends south of the border. We're going to ramp up. I have all the confidence in the world. I have all the confidence in businesses, into the people of Ontario. We've seen it in this crisis, how they have come together. We're all coming together, and we'll start driving the economy, the likes of which this province has never seen. That I'm confident about. I just want to get through this health crisis. We can control the economy, moving it forward. We can do everything we can to make sure we get through this COVID-19 crisis. That's what we need to stick together, and we are sticking together, the whole province. But we'll get this province ramped up like you've never seen before.
This will be last question.
Thank you.
The last question comes from Travis Dunrush of Global News. Please go ahead.
Hi there, Premier. We saw yesterday that a Toronto police officer tested positive for COVID-19. There are concerns from firefighters and police officers that they don't have access to masks when they are going out on calls. Is there anything being done to change the situation and allow them to have access to masks so that they are protected when they're on the front line as well?
Yeah, I think it's essential that they have masks. And people have this kind of buzzword, this N95. That's the highest end mask for people that are dealing directly with people with COVID-19. But there's other masks out there that will protect our frontline responders. And I think everyone knows how much I love our first responders and the police and the fire and paramedics. We'll make sure that they have the masks. I talked to a superintendent today. He said he had 50,000 masks available on Monday, because I asked him that exact question. I'll follow up with Chief Saunders and other chiefs. So I'll make sure the Solicitor General is following up with all the chiefs right across the province, along with the firefighters out there and all the chiefs in the fire department, along with our paramedics. It is critical. They're a priority. And again, we'll be making sure what we see on paper, on inventory, I'm physically going out there and checking to make sure we have that, and make sure we have the right distribution. Nothing's more important, and they're a priority. Frontline healthcare workers and first responders, they're the #1 priority. They're putting their lives on the line for us every single day, and I'm so grateful. We'll make sure they're protected.
The second question is for a colleague of mine. What will it take for you to impose a curfew or full lockdown? And is that something that has been considered yet? We have seen the numbers go down a little bit today, but are you considering putting more measures like that in place?
Well, we'll take the advice from our Chief Medical Officer And again, Travis, I think the people of Ontario, a vast majority, are all listening. They're staying inside. No matter what town you're in, you see the difference. And Travis, you see the difference here in Toronto. Typically, coming to Queen's Park, it would take me from Etobicoke about an hour and 15 minutes in rush hour. I think made it home the other night in 19 minutes. I'm thinking, wow, people are listening. People are staying off the roads, and people are staying in their homes. Again, we have to rely on the people to cooperate, and they are cooperating. So, but again, everything's on the table. So I'm going to make sure we always listen to our Chief Medical Officer of Health and take his advice in our health team. But Travis, I want to thank you. I want to thank the people of Ontario. We're going to get through this. We're going to get through it. There's some rough waters ahead, but we'll make sure as a team, Team Ontario, we'll get through this. And thank you.
Thank
you
you
so much.